What if I told you that dementia doesn't begin when you forget names, when you retire, or when you turn 70 years old, but it begins decades earlier, and changes are happening inside your brain that most doctors won't catch for another 15 years. By the time memory loss shows up, the damage is already advanced, but you can do something about it starting today. In this video, I'm going to show you what dementia actually is and why most people have it completely wrong, why it starts 15 to 20 years before you notice anything, the biggest risk factors, and a real prevention strategy you can start this week. I'm Dr. Kabir Harricharan Singh, and the reason I'm making this video is because the science on brain health has shifted dramatically, but that shift hasn't reached most people yet. So let's fix that. Quick disclaimer, though I'm a physician, I'm not your physician. Everything here is educational information only and not personal medical advice. Always talk with your doctor before making any health decision. Most people think dementia is just getting old, but it's not. Dementia isn't even one disease. It's a syndrome, meaning a collection of symptoms that includes memory loss, difficulty thinking, language problems, and personality changes. The most common cause is Alzheimer's disease, but there's also vascular dementia, Lewy body dementia, and frontotemporal dementia. And here's the critical thing most people don't know. For decades, this was treated as an inevitable part of getting old, with nothing you could do about it. But that thinking is changing fast because there's a growing movement amongst neurologists that focuses on something totally different: prevention. Here's the part that stopped me in my tracks when I first learned it. The toxic protein buildup linked to Alzheimer's, called amyloid, can begin accumulating in your brain 15 to 20 years before you ever forget a single name. Let me say that another way. By the time memory problems appear, the disease process is already advanced, which means if you're in your 30s, 40s, or 50s right now, you're not too early, but you're right on time because the window to protect your brain isn't in retirement, it's right now. Let's talk about what actually moves the needle. Risk factor number one is insulin resistance. Some researchers have actually started calling Alzheimer's type 3 diabetes because your brain runs on glucose, and when your body stops processing it efficiently, the brain suffers first. High fasting insulin, metabolic syndrome, and type 2 diabetes all significantly increase your dementia risk. So when you next see your doctor, ask them to evaluate you and see if you have insulin resistance. And if you do, work with them to create a plan that reverses it. Risk factor number two, vascular health. There's a saying in medicine, what's good for the heart is good for the brain. High blood pressure silently damages the tiny blood vessels that feed your brain. Poor cholesterol, specifically high ApoB, accelerates the damage, and smoking, sedentary living, and poor circulation all negatively impact your brain health. So control your blood pressure, know your ApoB, and move your body. Risk factor number three, chronic inflammation. Your brain is protected by something called the blood-brain barrier. Think of it like a highly selective security gate that lets nutrients in and keeps toxins out. Chronic inflammation attacks the barrier, and when it breaks down, the brain becomes vulnerable. Markers like high sensitivity CRP and homocysteine can tell you how much of an inflammatory burden your body is carrying. Risk factor number four, poor sleep. While you sleep, especially in deep sleep, your brain runs a waste removal system called the lymphatic system. It literally flushes out the toxic buildup linked to Alzheimer's, but poor sleep shuts that system down, and untreated sleep apnea is one of the most under-recognized dementia risk factors out there. So if you snore, feel tired despite sleeping, or wake up with headaches, talk to your doctor to evaluate your sleep. Risk factor number five, physical inactivity. Exercise isn't just good for your waistline. It directly grows and strengthens your brain because it increases something called BDNF, brain-derived neurotrophic factor, which is like fertilizer for your neurons. It boosts neuroplasticity, improves blood flow to the brain, and increases insulin sensitivity. So make sure your exercise regimen includes both cardio and resistance training. Risk factor number six, isolation and mental stagnation. Brains that are used adapt and grow, but brains that aren't wither away. Social isolation and cognitive stagnation are both independently linked to faster cognitive decline. Learning new skills, staying socially connected, and having a sense of purpose are like medicine for the brain. So pick one new skill this month and call someone you've been meaning to holler at, because these habits, they start compounding. So what does this all look like in practice? In an ideal world, your prevention strategy includes advanced metabolic labs like fasting insulin, ApoB, and lipid particle analysis, blood pressure control, consistent exercise, both aerobic and resistance, sleep evaluation, especially if you have signs of sleep apnea, cognitive baseline testing, and for a select group of patients, ApoE genetic testing to understand your risk. Remember, dementia is not inevitable, but the risk and the protection accumulate silently for decades. The leaders in preventive neurology are changing the game, and the window to protect your brain is open right now. Your brain doesn't decline overnight. It declines or improves daily, and small decisions made consistently compound over time. If this video gave you something valuable, please subscribe, because I'm going to keep bringing you the information that most people want to know to improve their health. I'm Dr. Kabir Harricharan Singh, and I'll see you in the next one.